Angelique Knight first met James Jeffrey Griffin when she was 14 during one of her many stays at the Launceston General Hospital.
I hated him. I remember him coming in and he was very touchy-feely the first time he even come into my bedroom, the room, and I screamed out and screamed that I wanted that man away from me.
She told the Commission of Inquiry her mum made a complaint, but not long after, Griffin became her nurse again.
I started to like him. I guess he just had me fooled very easily.
Ms Knight has complex health conditions and was in and out of the children's ward until she was 21. She told the inquiry she and Griffin became close and he was always hugging her, touching her bum and rubbing her back, even when other nurses were around.
I just always got told that was just Jim. He's a touchy-feely kind of guy.
Ms Knight told the inquiry Griffin's touching turned intimate when she was in the hospital, and this continued until her late 20s. After she learned Griffin had died, Angelique Knight went to police and told a woman at the front desk that she wanted to make a statement about her abuse.
She came back to me pretty quickly and said, sorry, there's nothing we can do. We can't charge a dead person. But I'm sorry that this has happened.
Angelique Knight told the inquiry she was back in the hospital's emergency department just last week. She said she was watching the Commission of Inquiry live stream on her phone when the head of nursing came over and asked her to be discreet because it impacts staff.
And I felt asking me to be discreet, I just felt ashamed, really, like what I had to say no one wanted to hear.
Ms Knight said no one from the LGH had formally apologised to her. This afternoon, that changed. The head of the health department has watched firsthand the past 7 days of evidence.
I've had many I wish moments this week. I wish I had done, I wish I had asked more, I wish I had dived deeper, I wish I had known X detail and acted earlier.
She offered individual apologies to the many victim survivors, their families and staff who tried to raise the alarm. To Ben Felton, the family of Zoe Duncan, Kirsty Neely, Angelique Knight, Tiffany Skeggs, Keely McMahon and her mother Annette Whitemore, Kylie Pern, hospital staff Will Gordon, Maria Unwin and Stuart Miller, and two mothers who suspect but will never know for sure if or to what extent their daughters were abused by Griffin.
I apologise for the failures of the Department of Health, in particular by the Launceston General Hospital and the Tasmanian Health Service. And I commit to making large-scale change. I'll do my very best to lead health, to right the wrongs of the past, so that no one in health now or our employees of the future will ever forget the reasons why we must place the safeguarding of children and vulnerable people at the centre of our care.
Ms Morgan-Wicks will give more evidence in August. Ellen Coulter, ABC News.